Hi, I'm Marie Hefner. I am a hepatology nurse practitioner. I work in Southern California at Southern California Liver and GI Centers. It is a community-based practice, and we have many referrals that come to us from our primary cares in the area. So one of the big questions is, what do you want me to do with these patients? And so my answer to them when they call me and they ask me that, I say, so what have you done? And most of them will tell me that they've taken a history, they have elevated liver enzymes, and they're fat. So I said, okay, so now that we know all of that, what tests did you order? And so again, they'll say, well, I ordered my liver enzymes. I did this, I did that. Now what do? I go, okay, so we try to get them a FibroScan. We ask them to send they can come to our practice and we'll just give a FibroScan and then we'll send the results back to them. And I'll then sit down with the primary and say, okay, so here's what's going on and here's what it is. We have an F01. We have very, very early. So you can manage this within your own practice. So how you manage it in your own practice is to measure that, is to weigh them, bring them in on a regular basis, however often you bring your patients in, but at least once a year. And you need to reevaluate them every 2 years of getting extra labs for them. We can get FibroScans again for them. You can get an ultrasound on year 1. You can get an ultrasound now. So we have an idea. So we get a lot of baseline information on a F01. Is it perfect? No, but at least it helps. If the patient's not losing weight or not getting better, they can send them to me at any point in time. And I tell them that. With the F2s and 3s, we talk about a plan of care and how to do it. And then they decide whether they want to manage that within their own practice or whether they don't want to manage it. And there's lots of reasons for that in Southern California. And if they're an F4 or an F3 or F4, I tell them to send them to my practice because they're almost cirrhotic or cirrhotic. And those require a little bit more care than primary care wishes to do because I have to take care of the cirrhosis as well. So we take and then we'll do all of those kinds of things. And they still have access to me whenever they want access to me. They can call me. Most of them have my personal number, so it's easy for them to get a hold of me. And we'll go from there. That's probably one of the biggest ones. The second biggest one is, what do I do with the patient who has fatty liver disease? It comes back on their thing that they have increased echogenicity and then it comes back increased fibrosis, but they really don't know what that means. We get, again, the FibroScan tells us, and if they have a FibroScan, and some of them have FibroScan machines in their offices, we ask them what the scores were and what's going on. And then based on that, again, whether they're an F01, they can do in primary care, F2, 3, they come to or F2, they can probably manage in their primary care for a while. And then F3 and 4 just come over to us as well. They also give one more question because the first 1 and 2 were kind of the same. The third question is how do I do a FibroScan? And we talk to them and have them find somebody in their area that does it. They're welcome to come to us and say, are in Southern Cal, or they're down in San Diego. They usually just come to us and then we can give it to them. We actually try to bring the providers to the office, show them the FibroScan, show them what we're doing so they have an idea of what they are doing with their patients. Thank you very much for listening.